Good evening and welcome to A Closer Look. I'm your host, Marcos Umbrister Jr. Tonight on A Closer Look, we're getting real about health in the Bahamas, the issues, the solutions, and the people driving change. From the Brightness Action Initiative restoring sight for those in need to the Bahamas National Drug Council's youth programs keeping our young people safe and empowered. We'll take you inside the initiatives making a real impact. Plus, frontline doctors are sharing practical tips to help you prioritize your well-being as we step into 2026. This isn't just talk, it's about action, results, and shaping a healthier future for every Bahamian. Stay with us as we dive in.
A memorable stay isn't made in a single night. It's shaped in the details. Every sound, every glance, every touch. Where you're not just welcomed, but understood. Where time slows and every comfort feels effortless. Whether it's the shimmer of the pool, the quiet of a suite, or the taste that lingers long after dinner, each moment becomes a part of your story. British Colonial, where legacy meets luxury. Stay for what it means to you.
Welcome back. I'm Marcos Umbrister Jr. and you're watching A Closer Look. As drug use continues to impact families and communities, the Bahamas National Drug Council is shifting prevention from talk to action, rolling out youth-focused programs aimed at education, resilience, and real-world decision-making. Here's April Smith with a closer look at how these initiatives are shaping the next generation.
The Bahamas National Drug Council leads the country's efforts in public prevention of drugs and education, working hard to promote drug-free communities nationwide. The mandate of the Bahamas National Drug Council is clear: to reduce the demand for drugs and promote healthy drug-free lifestyles across the Bahamas through prevention, education, and early intervention. The council's work centers on reaching people before substance use becomes a problem, with a strong focus on youth, families, and communities.
The research has showed us that 30% of our adolescent population is depressed, 25% has suicidal ideation, and 27% has engaged in self-harm. So that means that all young people are at risk. We can't say that any one group of children have been safeguarded. And so at the Bahamas National Drug Council, we've developed programs from the cradle to the grave.
One of the council's flagship initiatives is SADD, S-A-D-D, Students Against Destructive Decisions, a school-based program that trains young people to lead peer-to-peer conversations about drug use pressure. Another program goes by the name Ignite.
Ignite is a program for the grade 6. This is in our government as well as a private school. The meaning for Ignite is inspiring growth, nurturing talent, and empowerment. We have 4 basic topics that we talk about. This is year-round. So we talk about soft skills, hard skills, as well as the drug substance abuse.
Then there's Explosion, a youth engagement initiative that uses interactive sessions and positive messaging to encourage drug-free living.
So Explosion is a selective intervention program for primary school students in the grades 5 and 6. And we are targeting at-risk students because we realize now that their transition from primary to junior school is crucial to catch them early on before they get into the junior schools.
Through outreach and awareness, the Bahamas National Drug Council continues its efforts to reduce substance abuse across the country. Reporting for A Closer Look, I'm April Smith.
Thank you, April. National Health Insurance, also known as NHI, is transforming the way Bahamians receive health care in the Bahamas. It guarantees affordable, quality primary health services for all residents, and it lays the foundation for a more equitable, people-centered health system. We now go to Krishna Russell with the latest on how NHI is shaping health outcomes across the islands.
Since 2017, thousands of Bahamians have benefited from the National Health Insurance Program. And as officials have told us, continuing to provide access to quality primary care is the name of the game.
In the Bahamas, healthcare is not just a service, it's a promise. At the center of this promise is the National Health Insurance Program, where transformation is priority, according to Christy Butler, NHI's managing director.
I think I have a slogan for right now, and I think that slogan is yes, we can. Yes, we can transform healthcare in the Bahamas. So as the CEO of the National Health Insurance Authority, I see our role as both foundational and transformative.
NHI offers access to essential healthcare services without additional cost to Bahamians. This ensures no one is left behind.
We want to ensure that through the NHI program, we're strengthening our healthcare system. We have a focus on primary healthcare, which really is the foundation of any thriving healthcare system. We want to make sure that care is coordinated and affordable for Bahamians.
And the problem NHI is designed to solve is simple but powerful: access.
We want to ensure that the NHI program is providing equitable access to healthcare services. And for us, that equity means across the archipelago of the Bahamas.
Ultimately, no Bahamian should ever have to choose between health and survival.
We also want to address gaps in access to care in critical areas such as the Family Islands, for critical populations such as the vulnerable in country.
And in case you're wondering, NHI offers benefits including free doctor visits, laboratory services, pediatric care, maternity care, in addition to screenings for early intervention.
Enrolling in NHI is simple. You can visit their offices on East Street or log on to nhibahamas.gov.bs. For a closer look, I'm Krishna Russell. Back to you on the desk.
Stay with us. The conversation continues right after the break.
This is the National Youth Guard program designed to train young people to help the Bahamas Islands in times of disaster.
I decided to join to better serve my country as well as to better myself.
We train the help in search and rescue,
electrical, plumbing, and carpentry,
and things that they can actually expand on in their careers.
Young people who join the Youth Guard program discover a sense of identity, a sense of purpose, and a sense of patriotism.
This program isn't about only the individuals, it is about the country.
Welcome back. Thank you for watching A Closer Look. For many Bahamians living with preventable vision loss, help is finally in sight. Through the Ministry of Health and Wellness's Brightness Action Initiative, free, life-changing eye surgeries are restoring vision while strengthening public eye care services. We go to Erin Scavella with a closer look at how this program is making a clear difference.
The future of healthcare in the Bahamas just became a bit more clear thanks to the Brightness Action Initiative launched by the Ministry of Health and Wellness. This initiative is a collaborative partnership between the government of the Bahamas and the government of the People's Republic of China. The program targets cataracts through free specialized surgical care at Princess Margaret Hospital.
The Bahamas suffers from large amounts of chronic non-communicable diseases. As a matter of fact, we did a STEP survey and it verified that many of these illnesses are pretty much the highest in the region. Diabetes, high blood pressure, and chronic non-communicable disease predisposes you to cataracts. And so we saw a proliferation of cataracts, and we reached out to private sector partners, and the Chinese government partnered with us and is providing this gift of vision free of charge to the Bahamian people.
The initiative aims to deliver more than 200 cataract surgeries. Patients from New Providence and the Family Islands are benefiting from the advanced equipment and the expertise of visiting specialists working alongside local medical professionals.
It is something that we have been working on for about a year in collaboration with a medical school in Hubei province, where they would come to the Bahamas and provide these life-changing surgeries for Bahamians who suffer from cataracts and to some extent retinal detachment. The program is ongoing at the Princess Margaret Hospital in collaboration with the PHA, my ministry. And we started the program on the 5th of this month, and the program is in full swing.
At its core, the initiative reflects the impact of international cooperation in healthcare, delivering immediate results while building long-term capacity for the future of vision care in the Bahamas. And thanks to initiatives such as this, we can look forward to seeing clear results for our Bahama land. Reporting for a closer look, I'm Erin Scavella.
Thank you, Erin. As we step into 2026, health professionals are urging Bahamians to move beyond resolutions and take real action when it comes to their well-being. From preventative screenings to healthier daily habits, doctors are sharing practical advice to help you and me prioritize our health in the year ahead. For this segment of ACL On The Go, we go to Tizelle Lightbourne for more.
As we enter 2026, the health of our nation remains a critical priority. Tonight, we take a closer look at our health with the Public Hospitals Authority. Deciding where to begin with our health journeys is often the hardest part. Dr. Indira Minus-Grimes shares what we can do at home and with professional help.
To stay healthy, one would advise that you maintain your regular checkups with your physician, know what your health status is like, be aware of whether you're at risk of any chronic medical problems, and have them addressed by a health professional. Talk with the health professional about the goals you want to attain to make sure that you're staying healthy. Of course, there are things that we can do at home, that is maintaining great lifestyle changes, such as a healthy diet, maintaining regular physical activity, usually an aerobic type of physical activity.
Dr. Crispin Gomez honed in on men's health, specifically advising how to protect their well-being across their life course.
There are different ages depending on what you are, things that we check for. Usually in the younger adults, we make sure everything is good, but we look at your activities and your behavior. We also look at men over 40, checking your prostate, making sure all is well with your prostate and there's nothing going on. If you have any issues in terms of your urination, that you come and seek help and let us sort it out.
Fear of the unknown often drives people to the emergency medicine department. Dr. Jessica Knowles clarifies when you should go and ended with essential advice.
For your accidents and emergencies, you have a car accident, you fell down some stairs, you have this headache that's the worst headache you've ever had in your life, you have chest pain, your stomach is hurting, you vomit and you can't stop. And that it isn't always that you have to come straight to the emergency room if you're not sure. It's actually pretty safe to see a community healthcare provider, and if they need to, they can always redirect you.
Thanks to the medical professionals at the Public Hospitals Authority, we learned key tips on how to be the healthiest versions of ourselves all 2026. Reporting for a closer look on the go, I am Tizelle Lightbourne.
Thank you for that, Tizelle. When we return, we're joined in studio by the Minister of Health and Wellness. Stay tuned. You won't want to miss this.
Discover the Bahamian soul at the National Art Gallery of the Bahamas, where color, culture, and bold expression all come alive. Explore our vibrant exhibitions, artist talks, and hands-on workshops. Stroll through our renowned art park, or find local treasures and exclusive merch in our gift store. Stop by our intimate satellite space at the Current Echo in Bahamar. We're open Tuesday through Sunday, and on Sundays, admission is free for all Bahamian citizens and residents. The National Art Gallery of the Bahamas, our home for Bahamian art.
Good evening, Bahamas, and welcome back to A Closer Look. Healthcare continues to be a top priority for Bahamians throughout the entire Bahamas, and tonight I'm joined by none other than the Minister of Health and Wellness to talk about all things health in the Bahamas. Ladies and gentlemen, the Honorable Dr. Michael Darville. How are you this evening, sir?
I'm good, and all the best for 2026 to the audience.
We cannot wait, especially with everything that your ministry has to bring to us. So let's just let's just get straight into it. It's 2026, it's a new year. What can we look forward to for the Ministry of Health and Wellness?
Well, first of all, 2025 was a very difficult year for the ministry because a lot of new innovative programs were implemented. And in 2026, we look forward to completing them so that we can roll out many of these innovative platforms that would improve the delivery of healthcare services throughout the country and make healthcare more accessible for Bahamians, not only in New Providence and Grand Bahama, but throughout the Family Islands.
And I love the fact that you mentioned, of course, it not just being all about New Providence, but ensuring that we have accessibility for all Bahamians. Can we talk a little bit about what that means for those on the Family Islands?
Well, for years, the delivery of primary healthcare services on the Family Islands did not have the focus that was necessary for the growth and development and many of the economic projects that are going on. In the last 3.5 years, we have been upgrading healthcare infrastructure, making sure that they're climate resilient, and addressing the manpower shortages for the delivery of these services.
Yes.
But the most innovative thing that we're in the final stages of developing is our digital platform, where we would launch a very robust telemedicine platform where patients in the Family Islands can access specialty and subspecialty services by way of telemedicine. And that is
so
an innovative part of our strategy going into 2026.
And I love the introduction of technology now. I'm ensuring that we're not being left behind. So let's even talk about the National Health Strategy. I know that that's going to be done over a period of time from 2026 to 2030. What are the top measurable outcomes that you're expecting to achieve by 2030?
Well, let me put it in the right perspective.
Yes, sir.
This particular strategy has been around for a while. The last health strategy was in 2010. There were some objectives. Some we were able to meet, some we were unsuccessful. And so we partner with KPMG to guide us to put in place the National Health Strategy that will be in alignment with the country's strategies.
Yes.
And in doing so, we intend to implement a very robust digital platform, create policies where care could be patient-centered,
yes,
to make healthcare more accessible, and to ensure that we incorporate more diagnostic, lab testing, and preventative care measures, which is absolutely the foundation before we launch the full catastrophic program by a national health insurance.
Oh, that's excellent. So can we explain even now the National Quality and Safety Program and how that's directly going to affect our patients?
Well, one of the things we've realized after consultation with the private sector and Bahamians at large, there is a discrepancy in the quality of services being provided in the public healthcare system.
Yes.
That is of great concern because we want to make sure that when patients interface with our tertiary healthcare services and secondary and primary services, there's consistency of care.
Yes.
And so there is a program.
And no matter where you go.
No matter where you go. It's very important that if I go to a far-flung clinic in Meguana, I get similar services as if I go to a clinic here at one of the polyclinics in Nassau.
Very good.
And that requires quality control measures where we are putting teams in place to monitor healthcare delivery systems and protocols in place so there could be consistency of services across the country.
That is so good because I think even we look at not just the Family Islands, but even the disparity that you might receive in the over-the-hill communities compared to coming to the actual hospital. I think a lot of times people feel as though they don't get the same level of service. So doing something like that, ensuring, how do you now even ensure that the quality is being maintained?
Well, first of all, it's by putting in place various different protocols. And so let me give you an example. In our clinics, we have a general protocol called the HEARTS protocol, where the tests, diagnostic, lab tests, consultation is similar across the board.
Good.
And so all of our healthcare providers are trained to ensure that if a patient comes to the clinic suffering from hypertension or diabetes, the protocols are set. And the delivery of these protocols must be consistent across the board. And the diagnostics lab, as well as the medications, are consistent throughout the clinic, which allows quality measure control by way of digital platforms. And the beauty about it is that with cybersecurity, our e-clinical records, we have the capability to know what's going on in every clinic and do a better job to monitor it from a digital perspective.
And you're speaking about the digital perspective. I know that we talked about telemedicine being added in. What other forms of digitalization are we adding into the healthcare system now?
Well, the electronic medical record is something that we have been working very, very diligently to bring to the forefront.
That's awesome.
The funding for the electronic medical record is by way of an IDB loan facility. And as we speak, we have about 14 to 15 IT specialists that is working in collaboration with the Department of Public Health and the Ministry to launch our digital healthcare records. And these digital healthcare records will be able to assist the government in creating policies, because now for the first time, we are able to use the digital platform to see the incidence and the trends of diseases in the country. And with that information, it allows the ministry to establish policies that will address the trends and begin now to address the challenges in the healthcare.
And what's so good about that is that now moves us from trying to fix problems after they occur to now going into a preventative measure. I know that we also have the Future 2.0 campaign that's based solely, well, not solely, but a lot on nutrition. And we can talk about how that now is going to impact what healthcare becomes in the Bahamas. Tell us a little bit more about the Future 2.0 campaign.
The Future 2.0 campaign is a very innovative program. But I want to just speak a little bit about Health Promotion and Wellness Bill that I laid in Parliament that is presently enacted. The beauty about this bill is with the ministry's wellness unit, we will begin now to put in place wide cross-section of educational programs to begin to teach Bahamians the importance of nutrition, while at the same time showing them the importance for lifestyle modifications. I don't know if you're aware, but 80% of non-communicable diseases that we see in the country are preventable. They're brought on by choice. And as we begin now to, absolutely, with lifestyles. And now that we're able to put programs in place for education, both at primary school, secondary school level, as well as at our various clinics, we will be in a position now where we'll begin to teach Bahamians the importance of proper nutrition. And this is all tied in with the government new policy where we now have zero VAT on consumable foods purchased in our grocery store, giving Bahamian choices
now
to
we're
select.
seeing where the ripple effect
That's the ripple. So health promotion and wellness, the 2.0 program, allowing Bahamians to access quality foods at more affordable prices. And this was a strategy that was laid down by the Ministry of Finance in conjunction with the Ministry of Health to ensure that Bahamians can access quality, nutritious foods at more affordable prices. And that's the reason why foods purchased at the food stores are now zero VAT.
Let's talk about how we are addressing now our healthcare shortages, whether that be physicians, nurses. What are we doing not only to ensure that we have quality consultants and persons in these subspecialties, but also what are we doing to ensure that Bahamians are able to also become physicians and become to fill these roles more than just bringing in other people?
When I became minister in 2021, the latter part of 2021, we did an audit of the deficiencies of manpower resources in healthcare. And what we found that as a result of coming out of the COVID-19 pandemic, a lot of our trained healthcare professionals, particularly nurses, we lost them by countries abroad recruiting in the English-speaking Caribbean. Healthcare shortages is not exclusively to the Bahamas, it's regional. You are a student at the University of the West Indies, and I know you experience it where you're at. Our job is basically to address these shortages both in the short term, medium term, and long term. The short term is if there are deficiencies, you need to find healthcare professionals.
Yes.
If they're not in the country, you must find them internationally. And so you'll see our strategy where we are able to bring in healthcare workers from Ghana and from around the world, the Philippines and even India, to fill these gaps.
Okay.
I've done that. But that is only a short-term strategy. The medium and long-term strategy has to do with training healthcare professionals, training medical doctors, training nurses, and training allied healthcare professionals.
Yes.
This is one of the reasons why we put in place the PHA Academy to address allied healthcare workers. But what we are doing is a little bit more innovative. We are partnering with private universities and colleges locally. I have programs at Tarif College in Grand Bahama, Bahamas Baptist University College here in New Providence, and I'm going to go into an MOU with Sutton College where we're trained clinical nurses and nurses, not only at UB, but with private sector groups. This is proving to bring forth a lot of positive fruit for us in the Ministry of Health. And I don't know if you're aware, we did a graduation with the PHA Academy where we trained EMT specialists, farm techs, individuals responsible for digital clinical records. We have been trained clinical nurses, and all of these individuals on completions are absorbed into the system. The beauty about our training programs is once a Bahamian come in our training program, they come with a stipend.
Oh.
So we do give our students stipends.
I hope our people are taking advantage of this.
Of course they are, because we realize that we want to make sure that many of the mothers, as well as students who may have children and who cannot come into a program without an income, have access to the stipend. That is also proving to bring forth fruit, because 90% of our students are graduating and now developing careers in healthcare and being a part of the healthcare delivery system.
Minister Darville, thank you so much for being with us today, Minister. And of course, we can't wait to have you back. Stay tuned. The Closer Look continues right after this break. Welcome back, and thank you for staying with us all night long. As we conclude tonight's episode, what we've seen makes one thing evident. Health is firmly on the national agenda. From the Brightness Action Initiative restoring vision to youth programs tackling substance misuse and doctors offering practical tips for everyday wellness, we've seen how initiatives and individuals are making a real impact. The work being done today is shaping a healthier, stronger Bahamas for tomorrow. Remember, prioritizing your health isn't just a choice, it's a commitment to yourself and your community. From all of us here at A Closer Look, I'm Marcos Bristol Jr. Good night, Bahamas.